Our next session is on a role of anesthesia technician in patient safety. For this session, I would like to request Mr. Edward Jonathan to take the session. I will quickly read out his brief introduction. He is having a 10 years of experience in the field of anesthesia technician. He is currently associated with CMC Vellore, and he is a BSc in Operation Theatre and Anesthesia Technology. So over to you, Mr. Edward. Please carry on with your session. Thank you.
Thank you, ma'am. Actually, thank you so much. Thank God and thank Kaho and rest of the people over there to, for giving me an opportunity to share a few talk about what we are doing. So I am right now here to speak something about the role of anesthesia technician in patient safety for next 10 minutes. So I hope everybody knew who we are. So we are people who provide the best care to the patient by assisting an anesthesiologist. So about a decade back, when people were actually thinking, we are thinking differently about this. But then when we sit here right now, as we are listening to all these beautiful people who just spoke before us, this is us anesthesia technologists who assist anesthesiologists, and this is our goal. So what do we do? So we are assisting anesthesiologists, and in various settings, like when it comes to general anesthesia or regional anesthesia, it requires so much of procedures along with it. So we assist in intubation, intravenous catheterization, nerve blocks, and epidural analgesia. And our second role is to maintain drugs and equipments. So greatly anesthesia consultant and anesthesiologists are dependent on the equipment, and it has to be maintained in such a way. So it includes sterilization, maintenance, troubleshooting along with whatever it is. So we maintain drugs and equipment, and third thing is we care for our patient. So this talk for next 7 to 8 minutes hopefully will be on this. So I would like to take you with an experience of a Mr. Rex. So he's an anesthesia technician who is just on a day, he just comes into the theater and then finds out, okay, it has to be a small list. And then he thought he'll get ready. But then unfortunately on that day, he is supposed to manage a thoracotomy for a 14-year-old. Say he has to get ready with all these equipments. He is so single-handedly he has to get ready. But then it is an opening day. So it is very hard for him to get all the things done. So he was trying it to be very fast, and then all of a sudden he couldn't able to get everything on place. But then it was about 8 o'clock, and then it has to be started. Surgeons are waiting for the patients to be taken care. So anesthetists were rushing, and he couldn't able to get things ready. So imagine this situation, how he will react, and what will be the outcome of all these things. So it is not a pleasant outcome, obviously. So that turns out to be the next thing. So it is always better to be prepared and prevent than to repair and repent. So for this, I wanted you to take you to our daily routine as an anesthesia technician, what we are usually doing. So our daily routine starts the day, and the very first thing we check when we enter the theater is suction. So make sure the suction is proper, the negative pressure is good, and there is no blockade, and the suction jar is emptied and it was kept clean. So it was maintained properly. So the very first thing which we enter theater is suction, and then we make sure the theater is ready for the operating patient. So second thing is about the oxygen. So once we are confirmed with the suction, we move on to oxygen and see whether the oxygen pressure is fine, whether the continuous flow of oxygen is there. If it is not a centrally supplied system, whether the oxygen pressure over there in the cylinder is adequate enough for the case, or if it is low, we have to change it to the another support cylinder over there. And or else if it is very limited sources over there, we have to ask the central manifold to connect a higher pressure of oxygen. And after connecting the oxygen, we move on to our electrical connections, where we make sure all our equipment is connected to an uninterrupted power supply, which is mandate because we are not sure about the electrical supply. So we cannot depend on the alternative current always. So we have to make sure the equipment are connected to an UPS. At least gas analyzer along with monitor and machine has to be connected to an uninterrupted power supply, and make sure the power switch is on. Sometimes the backside of the machine will not have a switched on. So if in case it's that way, we have to make sure everything is on and perfect for the day. And after that, once the machine is fine, along with the drugs, we have to make sure every other emergency drugs that has to be kept, as the panel discussion was happening, every other emergency drugs that is supposed to be kept inside the theater is made available, and it has to be checked whether it is drug is expired or not, whether if it is a multi-use vial, we have to make sure it is opened, and the date of opening has to be mentioned over there in the vial. And apart from the emergency drugs or the drugs that is needed, we have to make sure other drugs as well, like antiemetics and antihypertensive and antihistamines, to be always on table. I will make it as a practice that antihistamine is always there on table, whatever happens. So all steroids and adrenaline has to be there in the theater always. So moving from the drugs, we move on to monitor and machines. As everybody knew that it is, we are supposed to check whether the machine is fine from the top to bottom, from the electrical circuits to the breathing systems. So if there is any leak found, as before anesthetist turns up into the theater, we make sure that breathing system is leak free. Every other the breathing circuit is according to the patient. If it is an adult patient, we just turn out to be an adult circuit, and if it is a neonate, we downsize the breathing systems to neonate, and we set all these things. So apart from checking whether the machine is fine or not, we have to have a backup plan as well. So we make sure that there is at least one, that is either a Jackson Reese for a pediatric or a Bain circuit for an adult, along with a self-inflating or a ambo bag, which is present inside the theater if oxygen or anything fails. So having a backup plan, having been prepared for any other cause, is really important. And then we make sure in our institute that it is always present, invariably in every other theater. And apart from that, we make sure every other monitor is properly functional. Apart from being connected to the electrical system, it has to be functional properly. And be if it is a neonatal ECG has to be placed, and if it is a BP cuff of neonate is available, we have to make sure it is dependent on the patient and the surgery that has been posted. And after that, we go on to the airway equipment. As everybody knew, all our airway gadgets has to be on place, and it has to be properly functional. It is not, we make sure it is not of the availability, it is about the proper functioning as well. Sometimes when we give a laryngoscope, the bulb may be flickering. So we have to make sure that we provide a proper equipment for the anesthesiologist to function better. And as a backup, we have to make sure that at least one plan B is available. Say if we are planning to intubate a patient, having a supraglottic airway devices or such LME in place is really mandate. At least a plan B has to be there. And the disposable. Inevitably, even every other setup requires a disposable that is adequately replaced. We cannot manage with just two syringes for an GA. So having disposable adequately replaced for a case is very important. And this is our daily routine. Once we are done with all these things, we move on to our day. So I would like to take you through this journey about our role in every other aspect, that is pre-induction, induction, maintenance, extubation, and post-anesthesia, how we do. So when it comes to pre-induction, as everybody is seeing, actually it is very important for us, as we were listening to so far. It is very important to plan for a day. So when the previous day, what we usually used to do in our institute is our consultants will call us the previous day over the phone, or if it is nearby, we will meet in person and then we discuss. So we communicate with our anesthetist about the next day plan. So what we are going to do, what is expected for these things, and we have consultants who will summarize the whole list for us, and then the requirements for every case. Say if I am posted in pediatrics, say there are some 5 cases to be done, this case has to be ready with all these equipments. This needs such kind of an anesthesia. So they will debrief us the previous day. So communication with the anesthesiologist is very important. The second thing is we communicate with the patient. Once the patient comes in, we make sure they are fine. We rapport with them for a brief moment, and then we make them comfortable. And the third thing is we will be there with the patient, transferring them from the holding bay or a receiving area to the theater. We wheel them in, and then we transfer them with a care, because sometimes when the trolley moves, they might get fall down. So we will make sure the trolley is held together so the patient safely moves to the other side of the trolley along with the nurse assistants as well. So after doing the transferring, we make sure the monitor are on. Taking base vital is very important and for documentation sake. So we make sure the monitors are properly connected. At least one baseline BP is taken before we do anything. After that, we move on to our intubation. So this is a
Edward,
very
last
crucial
one
part,
minute.
as
Edward,
everybody understands that. Yes, sir. Yes, sir.
yeah, 1 minute more. Yeah,
So
we,
once
yeah.
induction, yes, okay. Once induction and intubation is there, we make sure that drugs are ready, equipments are ready for intubation. There is a tube backup plan as well, and for procedure, we make sure we keep the equipments ready for whatever the type of regional that is supporting. So apart from that, what I really feel is positioning is very critical. So positioning a patient by making sure all the equipments like jelly pads, rolls for pressure points is kept ready before positioning, and temperature management is mandated. So anesthetists are really dependent on a temperature management. So we make sure we have forced air warmer. We started improvising our limitations as well. So we went into limiting using our underbody fluid warmer and overbody as well. And these are the airway agents we has to be kept ready for the extubation. Apart from that, post anesthesia care also we used to supply our support, that is securing and venous access, securing an epidural, securing an NG, airway emergencies and PSC. We started addressing it, and every little thing counts in a crisis. So we, as an emergency, we make sure that machine is ready, airway equipments are ready along with drugs. We make sure ultrasound is ready for regionals as well. And then apart from that, we contribute in times of need like CPR. So we started learning how to use defibrillators and then using a crash cart in need, and then make sure the drugs are available for the emergency situations like cardiac arrest. And then we help anesthetists in outside peripheral areas as well. So these are the zones where we are extending our care as well. So I would like to show this video how we in our institute do. So this is a video of a patient. So this is one of a patient, and these are the anesthesia team as well. So we make sure they are fine. Patient is not uh, anxious or any. We make sure our patients are comfortable. So this is a team of anesthesia technologists and the nurses over there in our institute along with the anesthetists. So this is how we care. And I'm so thankful that about a decade back, people used to say we are fit for only having micropods in our hands. But right now, I'm so thankful that we are a part of a team which cares for the patient behind four walls. So thank you. Thanks a lot.
Thank you so much, Mr. Edward, for your wonderful session. Uh, I would like to request all the participants to put up your queries in the Q&A box. Mr. Edward will answer offline. Moving on to the next session.